Good morning, and this is on this 3rd of January I'll be completing 46 years of my practice. So what I speak today is solely as per my own experience. Of course, my wife Dr. Vinodini is also our homeopathic doctor, and she is from the CMP college. She graduated in 1968 while I in 1964. So that is it. I am practicing at Prasad 1319 Prasad Chambers, Opera House, Bombay 4 for last 40 years at the same place. And these are my phone numbers. And now in experience, in practice, if one sees, generally we don't go exactly by law. What we feel and what we are being taught in theories doesn't go well in practice many times. Many times we have to negotiate and we have to adjust ourselves also, except one main thing is the law of cure. Law of cure, whenever you are practicing, whenever you have any doubts about whether you are going right or wrong, so this law of cure will explain, will guide you properly and tell you whether you are going in a right direction. So the law of cure is very well known to you all also. That is, the cure takes place from center to periphery, from above downwards, from more important organ to less important organs, and in the reverse order of the onset of the disease. So this you should always bear in mind, and whenever you have any doubts, you should be cautious of this. Particularly now when you are treating and you get, say, older symptoms coming up. Now as a constitutional medicine, if you are given, say, natramur, then you continue with natramur, and even the older symptoms come up, whether they cover up or they don't cover up. See, if the natramur is continued to be given, then it will take care of the older symptoms that has surfaced, and that also in due course of time overcomes, and then you further get further older symptoms that is surfacing up, and finally also it covers up. In a very less cases where you may require to give some intercurrent medicine or some other medicines. These are all my general observations for last 46 years, that most of the allopathic doctors, it is said that they do more of physical examinations of the patients, and they do not do or they do not have much time rather to go into details of the case. They just ask you CC. By the time you are narrating, the stethoscope is in the ears and he just sees here and there and the back. Whether he understands or he doesn't understand is a second point of view, but he just does it. So how much he hears, even the chief complaints, is doubtful, and then by the time your narration is over, his prescription is also over. This is what generally happens in allopaths, while it's the reverse in homeopaths. Homeopaths have lot of time in taking case. They take hours together for asking all the symptoms, particularly is the personal history and the family history and other things. But unfortunately, even when I am teaching in the homeopathic college at Parla, I have seen the interns, they bring the case written in a very beautiful way, filling all the pages of the case takings, but unfortunately they never examine the patients. So the person who does both, because if you listen the patient and don't examine, the patient is not happy. If you examine and don't listen or don't narrate the case, the patient is still not happy. So it is the person who generally does both, that he first listens to him and then he examines him thoroughly and then explains him the disease that or the problem that he is having in nutshell rather, then the patient is very much happy. So even before you write the prescription, patient feels better. See, this feeling better is a more important point when you take a case. When the patient is before you, patient has just come, you have taken the whole history in a proper way, you have listened to him well, then you examine him. First time all systemic examinations are to be done, whether you expect any findings or no. But for the psychology of the patients, you must examine the patients. That will pay you a lot. And then you, after you have examined, you come down and write the prescription. After taking the case, investigation is also more important. Generally, homeopaths, they feel that investigation is not required for homeopathy. No, it's not so. Homeopathy definitely requires investigations also, because investigations like say blood, urine, stool, X-ray, sonography, endoscopy, mammography, angiography, MRI, CT scan, PET scan, these are very helpful in practice. They will tell you whether when you have subsequent investigations done after few months, they will definitely guide you whether you are going in a right direction or not, and if so, how much improvement you have done and how much the pathology has changed. These things will satisfy the patients and their relations also. That is very much important from case taking. Now, my way of taking case and treating the case is little different. First, generally I take the case in detail. When I take chief complaints, say one chief complaint, second chief complaint, third chief complaint, along with its modalities, then I immediately think of medicines. Many times it is seen in when we are teaching in the college, they just take the whole case, they